intro?
Yeah, sure. Good to see so many faces and names that I know. So I'm Ryan. I run a training company in financial education and wellbeing. I'm going to talk a little bit in a bit, so I won't say too much. But I used to work in construction and on construction sites many moons ago, so really passionate about getting back involved.
Thank you, Ryan. Brilliant. So for those of you that are new, we normally have a bit of a theme of topics that we talk about, and I was been chatting to Ryan because they're doing quite a lot of work around financial well-being. I know it's a topic that just in society generally is quite on the tip of people's tongues with the financial crisis, but equally I know in construction there's lots of people looking at what does good look like in this space, what type of thing we can do. So obviously there's an initiative coming up, which I won't say anymore. I'll hand it over to Ryan and he can tell a little bit more about what's going on. We can have a bit of a discussion about what that might mean, and again, if you want to share any practices or anything anyone else is doing themselves at the moment, this is our opportunity to learn from each other. Ryan, so I'll hand over to you. Can you share your slides okay, or have you got the opportunity to present? I might have to make you a presenter.
Yeah. Don't worry, I haven't. The main thing for people to look at, really, I just thought I'd just talk through it and just answer questions,
okay, yeah.
Get the discussion going. But the main, if you want to see anything, there's the website, the financialwellbeingmonth.com website, which is the campaign. So feel free for everyone to jot that down and take a look. But yeah, I'll happily explain with Andy, you know, the story so far and what we're aiming to do, and then give an open invitation for people to get involved and ask questions, I suppose. That'd be all right.
Perfect. I'm just putting it in the chat so you've got access to the link for you.
Yeah. And some people know about this because I recognise names and faces from people on here. So sorry if I repeat myself. But yeah, I suppose for where to start, my background, as I said, was in professional sport actually, but then my first real job was on construction sites. And fast forward to working in financial services, and then realizing the need for financial education and better financial education, the stuff that we don't learn at school across all sectors. So I set up Finwell Training, which is a training company about 3 years ago, to really try and help people build their knowledge, understanding and confidence around money matters right the way through people's careers. But then what happened, unfortunately, lockdown, as everyone experienced, if you can remember that, and had personal experience with friends and family with mental health and also suicide, unfortunately. So made it my kind of mission to link our company and cover not just financial education, but mental health and suicide prevention, because they are all intrinsically linked. So some of you might know Alice Hendy from Ripple Suicide Prevention, and it was introduced to her. And because of our connection with West Ham Football Club, don't hate me, don't judge, we started to do lots of stuff together. And then was introduced to Simon Blake, who was the CEO of Mental Health First Aid England at the time. And we came up with this idea to raise awareness around all three areas, because they're all so important. There's some brilliant work being done in the mental health space, in the suicide prevention space. I don't need to tell anyone on here what the challenges are within construction. We all know them. We've talked about it for long enough. But we wanted to come up with a campaign to link all these three areas that was free, that any organisation could get involved with, and we could actually start to see results and start to see impact and start to see progress, which I'm sure everyone is keen to do. So we started to have the chat around it. Simon was brilliant at Mental Health First Aid England and said, look, we'll get involved with it, we'll help promote it, there's a need for it. Alice, obviously, on the suicide prevention side, and we're doing whatever we can to help on the financial education and wellbeing side. The campaign, you'll see it if you look at the website, it was launched in April last year. So we piloted it, really. We thought we'd do it. We put on a load of free events, free resources, free training for anyone that was interested, and just to see how it went. And it was really well received. So we have to do it now every year, and we've kind of committed to it. But it's an open invitation. No one kind of owns it. It's not, it's just for organisations to use it as they will, to try and improve awareness around these 3 areas and try and get progress made. Like I say, I think we've learned an awful lot. We've been lucky enough, we've worked with Craig at Ray's and other companies on construction sites and learn what works and what doesn't work in this sector. And over the last 3 years, I think that's a massive win, that there is no one size fits all for any of this stuff. You know, you have to find out how people learn, what people need, and how to approach it. So we're not perfect, but we've definitely learned a lot. And hence, and I'll introduce Andy, what we did in 2024 in April, we had lots of different events and roundtables and covered lots of different topics and themes along life's financial journey, if you will. But this year, the idea was to have a very sector-specific approach. So you'll see on the website, there's lots of different sectors that people are coming forward and asking us to get involved with now to share their unique challenges, because there are some unique challenges in each sector. So construction, you'll be pleased to hear, was probably one of the leading sectors that people just had lots of passion for and wanted to do something. So we put together a round table and invited people from throughout the supply chain to get involved with this, not just contractors, but clients, hence Andy. We saw the importance of having clients involved. And now it's a thing. Andy's talking, I'll let him speak in a sec. He's talking at the live event we're launching at Health and Wellbeing at Work in Birmingham in March. We're going to be sharing data. We've got an employer's guide that we're giving away for free. And just invite anyone to get involved. I know the one thing I'll say before passing over to Andy, that there's lots of groups, right? And one thing I've known since I was working on site in my 20s, that there's lots of groups in construction, and this is an invitation for everyone, really. Whoever's passionate about getting on, we don't want to go over old ground. We want to utilize what else is being done, but we're really passionate about, over the next 12 months, getting out there and doing certain things and seeing what works even better and sharing that with the industry. So feel free to connect with me or ask me any questions. But I'll hand over to Andy, because he's really leading the construction sector for the campaign, and he's very passionate about this too. Thank you, Ryan.
Thanks, Ryan. Yeah, so just on from my introduction earlier, really. Yeah, I think it's really key that a lot of these mental health and occupational health initiatives are driven or at the very least supported by the client sector. You know, we typically have, you know, a fair amount of influence when we're tendering for our projects. And I think by, you know, including discussions around the mental health and occupational health of the workforce that we're contracting with, you know, we can seek to make a change at site level. I think it's you know, one of the difficult things I've had to do is to convince my business that this is the right path to take. You know, a lot of the statistics, a lot of the data out there is assumptions. You know, we're not very good at collecting data on mental health. We're not very good at having those discussions. You know, we had an incident just before Christmas, so we use a digital platform to capture all of our incidents on our construction sites. We have health and safety consultants and the GCs that fill this for us, and I review all of the incidents from the previous week every Monday, and one of them really struck out for me just before Christmas, and the report basically said that a worker had dropped quite a large steel pipe on his foot, but didn't report it, carried on, finished his shift, but then that evening went to the hospital, ended up in a moon boot and was told to rest up for 2 weeks. Turned up for his shift the next day without the moon boot, and before the end of his shift, you know, had to speak to a supervisor and say that he couldn't carry on because he was in so much pain. Now, we'd got that logged down as a safety save, something we call a safety save, which is basically an observation. When I saw that report, I reached out to the site team involved, because to me it didn't sit right, and it was quite obvious that one of the biggest problems we have is if he was to take time off, particularly just before Christmas, he's not getting paid. You know, we've got a huge proportion of our workforce is self-employed, and they don't get paid for going off sick. And many of them, you know, aren't taking out insurances, you know, to cover themselves for such incidents. So I reached out and I asked for these questions to be asked of the person when we do the interviews, and to dive deep into this. And yeah, it turns out that that was the case, that the guy had, you know, decided to ignore medical advice and come into work in huge amount of pain just to get his days paid before Christmas. That enabled us then to have a, you know, further conversations with the general contractor to see what we could do to support that person, because it was quite clear he needed to take the time off, or he was going to cause himself longer term injury, you know, which will cause him further financial issues, you know, down the line. And yeah, I won't go into too much details, but yeah, we were able to make a happy ending out of that story in the end. But it's a huge concern how many people on our sites are going through this every day and causing themselves long-term issues because of the financial issues behind, you know, taking time off to go and see a doctor, you know, to get that niggle in your back checked out, or, you know, why do I keep getting these headaches? But I'm away from what I'm traveling away. You know, it's going to take me 2 days off work to go back home, see a doctor, and then come back. You know, none of this is taught when people are going through their apprenticeships and learning their trades. They're not taught about how to handle a self-employed wage, the, you know, insurances, pension, you know, putting money aside for holidays and stuff. You know, and we've seen the impact. You know, Ryan again can talk about the impact, and, you know, those of you that do know Alice Hendy, you know, although her brother wasn't involved in construction, you know, his suicide was very much financially motivated, because he got himself in a pickle and didn't know how to get out of it. So it's really, really important that we talk to the workforce and offer them the support. And we're very, very keen. I think one of the things, and Ryan touched on this, one of the things we're really keen to do is to have on-site presence. We can have, you know, posters up all over the site with phone numbers and QR codes to scan, but very often, you know, that taking that first step to speak to someone to say, you know, I've got a problem, I've got an issue, or I don't know how to deal with this, that prevents people every time, and that leads to the mental health conditions worsening. So by having someone on site, having, you know, engaging with the workforce firsthand through toolbox talks, you know, through the induction process, etc., but then making that support available on site as a drop-in, you know, function, they're much more likely to engage. You know, it's much easier just to knock on somebody's door, pop in and go, oh, you know, do you do this? Do you deal with that? The conversation starts then, and then we can get that person. And, you know, you get one person and that stigma starts to erode, and more people will, you know, start to think, oh, actually, I could do with some of that. I'll pop in as well. So that's what we're going to be focusing on this year. So we're looking at the middle of March of having Ryan on one of our construction sites in the Midlands, you know, to see how that looks, and then going forward, yeah, the plan for us this year is to have mental, financial, and occupational health support on our sites, not necessarily daily, but certainly a significant presence, so that we can start to engage with that workforce.
And Andy, so just I think it's maybe to go into a bit more detail about, so what this financial advice thing, what do they look like? I'm presuming they're not financial advisors, but are they people that have had obviously training similar to what Ryan's company offers?
I'll let Ryan answer that, because it'll be Ryan's people that do it. So he'll explain what it is they do. What do we actually do? Yeah. You've got to be really careful, Jenny, and probably people know on this that it's not advice. There's, when we first started, I was working with a financial advice company, actually, and a planning company, and my contact, it was Hayes Recruitment. If anyone knows Hayes, that was one of our first clients, and they specifically wanted a training only provision that wasn't linked to any products, and no advice was given. It's very much mirroring what's been done in the mental health space. So, as I say, I did my mental health first aid training in lockdown, and then worked with Mental Health First Aid England a lot, and with Simon. So it's about education and guidance and training and support. The hardest thing we've learned, the biggest challenge we had in the last 3 years, not just construction, across all sectors, was making this relevant and inclusive to everybody within a company. Because within all of your organizations, you're going to have people of all different ages, different income levels, different family situations, areas of neurodiversity, different cultural backgrounds, lots of different things. So we've kind of developed our services based on feedback, based on what people have asked us to do, and develop different things. But the stuff that we've learned for construction is as Andy said, to get onto site, it has to be on site, it has to be face to face, is the best way. To make the various training available as an opt-in, there's no obligation to do it, you're not going to force anybody to do it, and it needs to be consistent, it needs to be done over time, so that people can hear about it from their colleagues, from their peers, and access that support, whether it be mental health, financial well-being, whatever, when they're ready, but knowing that it's going to be available every month or every week or every 2 months, whatever. But no, to answer your question, it's not financial advice. We have to be really careful about that. Some of our team have got qualifications in that area. Obviously, we want to make sure they know what they're talking about, and they've got years of experience. But this is not about saying what to do or where to invest or anything like that. It's about having the basics. People need the basics, especially in the construction industry. The data and the stats will tell you, financial literacy is very low. So there's support via the toolbox talks that Andy had mentioned. We learned that worked really well, being at the start of the day and introducing the trainer, because they need to see that person and hear them and start to trust them and realize they've got nothing to sell, and then know that a one-to-one session is available perhaps, or that there's leadership training that's been developed as well for site managers, for supervisors, for key people within the organization. So a lot of data has been gathered, and a lot of kind of piloting and research has been done over the last 12, 18 months. But we're still at that stage. We're still right at the early stages. I think if you look at how far mental health has come on and how long that's taken and how far there still is to go, financial is still far behind. So I think linking the three areas is really important, and just raising awareness, letting construction companies and clients, as we've said, know what's available and what's happening, and be invited to get involved in whatever way they want to.
I think you've some really interesting points, definitely about the face-to-face scenario. And then you talk about what we do with mental health. There's still most contractors or organisations, they rely quite a lot on a nurse, for example. But those of us that are nurses on the call, we've never had any information or training around financial support or what that means. And it's actually, how do we get more people knowing enough about this? A bit like the whole mental health journey, we're talking a lot more about it, and more people are informed. Don't have to be an expert, just need to have a bit more of an understanding. But let's open up to some questions. Anyone got any thoughts, or especially if you've done anything yourselves in your own businesses, or seen anything that's worked, or got any scenarios where you've had similar challenges? That would be great to hear from some others. Val?
Yeah, hi. Yeah, we've actually had financial support on construction sites before over the past few years. Now, I'm trying to remember the company, but it was through the City of London's Business Healthy that we got those contacts, and they came in for free, and they just were we advertised it. We had them sitting in a semi-private space, but where people were walking by. There's lots of notices, and many people sort of sat down and utilized that time to converse about, so I don't have any data about numbers at the time, and we used them quite a few times on different projects in the city. And again, it's a one that we will be looking to replicate, but again, I will have to find the group that did it. And often with the City of London, they will procure a local business to do these sort of services for them. So they might have changed their procurement, and it'll be a different group now. But yeah, that's who I've always gone through for City of London projects.
And Bab, did you find the workers were open to come and see them? Again, I'm just thinking like the stigma with it. I know I've had similar sessions run on a previous job, and there was a little bit of, oh, we're going to be talking about debt. Everyone's going to think I'm in debt if I go and speak to this person, and trying to make them realise it's not all about money crisis. It's about other ways of looking at money. Yeah.
I think it's the words that we use on the campaign material and the advertising, isn't it, to encourage them that it isn't about debt, but debt can be one of the things. If so it's about the different words, and that applies across the board with mental health and people approaching anybody. Really, it's about the words and the confidence. I mean, I've had a few people come to me with really severe gambling addictions, to the point where they are suicidal. And once one comes and breaks that door, knocks on that door, unloads, the referral's done to the support service, and then they're quite evangelical about it. It's knock on the door, or can you help me? So it's a real sort of ripple effect that we find. And I like the fact that you've used Alice Hendy as well, because again, that's her ripple sort of card, isn't it?
Yeah.
So it's really about testing waters, and if you don't know what impact you're having, you'll never know what impact you're having unless you speak to everybody that's actually gone up to speak or to knock on a door. And that's a little bit intrusive, isn't it? It's a debate for the future about how data is collected and about impact. I
was going to add in there, if I can, that the challenges and the potential solutions are so similar with regards to mental health and where we were with that 5-10 years ago. Like I say, the stigma and the taboo, and I'd even use the word shame, and this is coming from personal experience as well, is massive, is more. Many people believe, and I agree, that there's a bigger stigma and a bigger taboo around money than there is mental health. And you're right, you just have to make this stuff available. You'd be surprised if it's consistent and if it's credible and if it's done in the right way and the right language is used and the right support ongoing is made available, it starts having an impact over time. And we need to measure that, and we need to show return on investment, of course, and things like that. But it's a big challenge, the construction industry. We work in all different sectors. Construction is probably going to be one of the hardest for various reasons, and you all know them. But I think it can have real massive impact. It's not going to be solved overnight. This is going to be an ongoing thing. But yeah, we have to get out there and learn what works and build on that. That's what we've done so far, and we're only just at the start of it. I really believe that.
Yeah, thank you. Craig?
Yeah, I was just sort of really interesting to hear. I mean, we've been lucky enough to sort of partner with Ryan, and the approach, I think, as I say, you may not get it exactly right first time, but for me, it's having the education piece, which may be done in a group setting, allowing people the opportunity either to drop in, which is quite good, or to have a private or one-to-one appointment. And then obviously, I think the follow-up support that people can access, maybe confidentiality, whether that's through the legal and debt service on their EAP or through access to lots of recognised charities. And I think the other area, when we talk about health, from my background, and encouraging people to make changes, the two barriers that crop up are always time and money, aren't they? And so straight away you've got a hook into the financial. So even if we're giving advice around nutrition or around physical activity or around learning and development, the money element crops up. So looking at options that are cost effective. And I think it's probably positioning it more into that coaching space. You know, everyone needs a coach. Roger Federer's got a coach. You know, Man City have got a coach. You know, so we all need sort of coaching. And I think taking it away from, you know, the financial regulatory side and much more into practical conversations around how do your habits stop you from saving money or going into sort of making the wrong choices or creating the mindset. So I think it's a really interesting area between the mental health side, the behavioral change side, behavioral economics. You know, there's some great books out there. Freakonomics, if you've never read it, it's fascinating in that we make decisions which are quite automatic. And when you start to have those conversations, people will have that aha moment, don't they, Ryan, where they go, oh, yeah, I always do that. So, you know, whether it's, you know, shopping at a certain time of day or, you know, when you're hungry. And I think once people start to realize they understand the push and pull factors, then they can start to take ownership of well. And what we found, I think, Ryan, is that you plant the seeds and then it's that interest later on. And, you know, a couple of months later, I'd also say just my final point is making sure it's within a wellbeing program. So it's there, it's up there with heart health or cardiovascular disease or mental wellbeing. I think if we can get it alongside there, then people know, and actually linking all the different components together. So whenever you're talking about fitness, nutrition, mental health, always have the financial aspect, I think. So yeah, thanks.
Yeah, thank you, Craig. Yeah, some really useful insights. Yeah, Ryan?
I was just going to add on to that, really. Yeah, that two things. One thing we learned that within construction in particular, there's this, what I like to call the changing room mentality. Having come from sport, there's so many similarities, and that's a big thing that we need to play into. That, yeah, starting small and letting, you know, people on site talk, you know, hopefully in a positive light, and that was our experience, luckily. That they'll listen to other people on site. It might be someone of key influence, a colleague, and then, like I say, access the support in their own time and at their own pace. Really, really important. The other thing we learned across all sectors is that one of the hardest things for individuals, for us, is just where to start with this. Because I don't know about anyone else on the call, there's loads of things that I need to improve, even on my financial well-being. You know, we've got so many things to think about or worry about as we go through life, and so many life events that can impact it. It's hard to know where to actually start. And what most of us do is go into denial and bury our head in the sand and hope it will just sort itself out, which it never does. So again, having a starting point we've developed and a measuring tool to let people, first of all, just have an introduction to financial well-being, what it actually means, how it is linked to their mental health, what areas of focus might they have, where might they be struggling, what goals or challenges might they be interested in that will have an immediate impact on their financial well-being. And the only other thing I'll say is the area that we don't get involved with, that people on this call will do and have brilliant influence on, is all the other areas. We don't tell companies how to pay their people or how much, or the supply chain, supplier agreements and payment terms. I know there's big issues and challenges around that as well. That has to be in place. You can't implement things like we're talking about going onto site and talking about your budgeting and things if fair pay just isn't in place, or payment terms or subcontractor terms. You know what I mean? There's lots of, this is why the construction industry is such a challenge and why I'm so passionate about it. But we can slowly get those ducks in a row, I think, and work collectively. I know there's some other brilliant groups you're part of, Jenny, and others on this call that hopefully collectively can make forward strides, I suppose.
Yeah, it's a really good point, Ryan. I think you know, there are loads of industry groups that are out there trying to do stuff, and it is how can they come together and recognise the parts that everybody plays in. There's not one answer that's going to respond to this challenge. There's so many different things that we need, and yeah, it's my conversations. You know, sometimes you speak to the construction workers, their response is, "Oh, I just need to get paid more," but the chance of them being able to manage that increase in payment doesn't mean that they're going to be in a financially better situation. So yeah, there's a lot of educating. I think, you know, it's just said for ourselves as well. I was wanting just to, I know when we spoke before, Ryan, I think one of the things that I really liked your suggestion was about upskilling the mental health first aiders in this particularly. So giving them that enhanced knowledge, because I imagine lots of them have this as a topic that comes up, but it's not part of the mental health first aid course. So have you seen that that's been a way of trying to get more understanding around financial health?
Yeah, very quickly on your point, just pay me more. We've had that. Every client, we work with over 100 companies so far, all different sectors and size, even globally now, and that's their biggest concern. Are our people just going to say, well, forget about all of that, that's great, just pay me more? And it honestly has never come up. Now, as I said before, fair pay needs to be in place, and reward and benefits and everything else, that's fundamental. But actually, just paying people more is not the answer. Honestly, it's a plaster. We'd all like more money. We have a saying at Finwell that the one thing more important than our ability to earn money is our attitude towards it, and we stick by that. But fair pay has to be in place. So that's the first point. And yeah, secondly, we was asked that the last sort of training service that we were asked to develop was leadership training. I think this is kind of the fifth area that we've learned with Andy and in construction, that there needs to be some leadership training. We've learned what that needs to look like. It needs to be offered on a peer-to-peer learning basis, not just a manager and leader, because you're not always going to go to your supervisor, leader or manager because of issues. You might turn to sort of a trusted colleague. But very much what we're trying to do is upskill and enhance on the good work that's already been done, hence why we work with Mental Health First Aid England and other mental health organisations. By the way, I just got off the phone earlier to Fiona from Suicide Prevention. You know, all of these areas, there's already networks of brilliant trainers that are delivering brilliant training, that have a passion about linking these areas. So our model, just so you know, I don't mind being open, is we're not recruiting ex-advisors or going down that route. We're looking at people skills that have got experience in mental health, that have a passion or personal lived experience within the financial side and want to upskill themselves in that area, and then deliver that to their network or their connections or their clients. So yeah, the only other thing that springs to mind, there's a massive, something we learned, we was asked to develop, was a way for mental health first aiders or anyone that might go on to support colleagues to have a way to put on their own oxygen mask first, we call it, because there's a massive element of imposter syndrome with this, where you feel, how can I possibly help my team, my colleagues, you know, around this, when really, you know, my mortgage has just gone up, I don't know what to do with that, I've got no pension in place, I've got no plans in place. So we see that a lot. So there's a part of it that helps them get a plan in place first, and then be able to share the method of that plan, as it was, to help their colleagues. So there's a lot to think about. You know, we've had to learn a lot of lessons just to get to this point. But utilising mental health networks, champions, you know, employee champions within organisations is really a good way to go.
Brilliant, thank you. And I suppose, Ryan and just to finish off, so with Financial Wellbeing Month coming up, what's the plans and how can people get involved?
The big plug, it's free, by the way. Yeah. So you just go onto the website. You can register for free. I'd encourage everyone to just register their company. There's hopefully a load of incentives to do that. In the month of April, like we did last year, we put on lots of free training, leadership training. We're offering places now for free. There's training that you can then invite all of your employees to join, covering different topics and themes, linking money, mental health and suicide prevention, a whole range of speakers that will be involved with that. So yeah, there's lots of stuff. There's sector specific groups, steering groups. Obviously, Andy is leading on the construction side, but we've got other groups, legal, retail, hospitality. So just get involved, reach out to me if you want, ask me any questions, connect on LinkedIn, reach out to Andy, be part of that steering group. I know there are some members of it on this call, but I think that's really, really important, that this is not seen as yet another closed off, you know, invite only group. That, you know, if anyone is passionate about this and wants to utilize any other groups that they're involved with or experience or learnings that they have, that's got to be the way forward.
Brilliant, thank you, Ryan. Does anyone have any other comments or questions or any thoughts for Andrew and Ryan? No? Well, hopefully you'll get lots of more support, and yeah, I'm really looking forward to seeing the events and what you've got planned throughout the month. I was going to pick up separately about one of my other clients that I think is definitely interested in what you're doing. So hopefully, as you say, over time we'll see this being a big part of everybody's strategy. I think everyone's very well aware of what they need to do, but it's just like, what does it look like in practice?
Yeah. The only other thing, and maybe I'll share with you, Jenny, after to send on, if anybody wants to go to the in-person event where Andy's speaking and Sarah from Lighthouse is speaking and there's other speakers, we've got there's free tickets that we can offer, or discounted tickets. So if anybody wanted to attend that in Birmingham at the NEC in March, then come along. I know there's already quite a few construction companies that are going to that.
Is anyone going to that already? There's probably a few on the call that I reckon will go in. Helena's saying yes. Yeah.
Hi, Helena.
I haven't been for a good few years, but okay, yeah, we'll send the details on and make sure we're aware. Brilliant. Okay, well, thank you so much. Was anyone got anything else that they wanted to pick up or share, or any other particular challenges they're dealing with at the moment? Or the last thing I was going to say was, any suggestions for anyone else that you think might add value in a similar way to Ryan and Andrew had to share in their experiences with the group? Any particular topics? And if the answer is no, that's fine, but send me a message afterwards. That's not a problem. Okay, brilliant. Right, well, let's give you some 5 minutes back, a bit of wellbeing time. Andrew, Ryan, thank you so much again. And yeah, anything you want to send over, I will forward it on in the emails. We will be having a recording of this, so those that couldn't attend were quite keen to still listen back to it. So I'll cut out all the introductions at the beginning and just have you two speaking, if you're okay with that. Brilliant.
Yeah, thanks for having us.
Great work. Yeah, we're really looking forward to following how this progresses. Thank you, everyone. Enjoy the rest of your day. See you next month.
Thank you.
Bye.
Thanks all. Take care.
Bye.
Bye.
Jenny, I'll send. Oh, she's gone. Valerie. Oh, she's gone as well.